Good afternoon. Thank you for inviting me to speak. My name's Rachael and I'm a disability advocate who lives with MS. For 14 years, disabled people and people of low income have suffered cruel, disproportionate ostracisation and punishment simply for being people who have always been disabled or who became disabled later on in life. We have faced the greatest assault on our well-being in living memory, not forgetting the forced do not resuscitates and the number of disabled people who died during the pandemic. Disabled and older people are now struggling to get the support to make their basic needs, let alone any extras such as respite care, days out and medical appointments. As we know, unlike medical care, social care must be paid for, and how much is a postcode lottery depending on what funding is available. Recently, my 87-year-old mother was discharged from hospital without a care package and we are still awaiting a follow-up from occupational health. In the meantime, I am a sole carer and living with multiple sclerosis myself means it is a daily struggle to make sure she is taking her medication and feeding herself properly, along with all the shopping and medical appointments she needs to attend. Nearly 30% of unpaid carers are disabled people who at some point will need care and support themselves. With unpaid carers currently saving the government $162 billion a year, this means disabled people who are carers are not receiving the care they need are in effect saving the government nearly £50 billion a year while not receiving that care. The current system is failing them as they have little respite care or support and carers report feeling financially drained. Disabled people of all ages and older people are the most at-risk group for being left on the floor frozen or awaiting ambulances for up to 20 hours. With excess winter deaths this year set to break all previous records, it will be the most vulnerable once again who die. While this system is run for profit and not for patient care, this situation will only get worse. 85% of adult social care services are run by the private sector, a large percentage of which are owned by just 4 companies, and the number one provider valued the company at $1.2 billion in June last year when it returned to a private company. What can we do? Well, we can keep up this campaign. Whilst the Labour Party are looking at a 10-year plan, private companies are still able to respond to tenders to provide services, whether that be care homes, domiciliary care, employment agencies or middlemen for migrant workers. This has to stop. Disabled and older people can't wait that long. The government needs to bring about a national care support and independent living service, starting with a radical new change involving service users, carers and workers in the local community to co-produce the creation of a free at the point of use social care service, which is publicly funded and radically reimagined, offering choice, control and dignity for all. Ensuring staff pay and conditions reflect their high value and skills, stamping out modern slavery and making the service more appealing for other people to want to join. They need to stop demonising disabled people, those living with long-term conditions and older people, and provide a social security system that catches them when they fall. Ultimately, we also need to make our communities more accessible and end social care charging once and for all. I will finish on this. It's now about survive or die. We absolutely must speak in those terms, lest we minimise the people who are at the bottom of this mess and what they are going through. In the meantime, please check on your family, friends, neighbours, because there are so many who are not receiving the care they need. Let's shout from the rooftops, stand for social care and end social care disgrace. Thank you for listening.